see what I was just doing with it? Like it's a tube top?
Oh,
I
okay.
was like,
Is that like put it underneath my bag or something? Oh,
Just
yeah.
put it across your
Later.
breasts, covering your nipples.
Well, I did that. I was
And
just-
then,
Clamp
yep,
it with
there
your
you go.
arms.
Okay. Yep. So from there, we want to be able to access the ribs all the way down. So it might be slightly lower than last week, because last week when we were doing the pec attachments, we only had to go out to the costal arch. Today we need to be able to go all the way around and access the ribs. Make sure our lotion's on our hands and it gets a little bit warmed up. So spread the lotion across the ribs. All right, now, just to review real fast last week. Last week we started on the ribs and we just stripped up at a 45-degree angle, moving towards the bicipital groove for the attachment for pec major. Pec major attaching under the clavicle, along the sternum, and along the costal arch. Those three attachments allowed for multiple actions. So they would pull the arm downward, across, and upward. Yeah, giving us medial rotation and shoulder flexion. When I say shoulder, what joint am I talking about? Glenohumeral joint, as opposed to the larger shoulder. A lot of people confuse glenohumeral with the scapulocostal, the scapula moving. This time, we're going to just palpate and sink a finger between each rib. Now your fingers, we're going to spread them apart to go between each rib, and then I'm going to lay my other fingers nail over nail. That way they're stronger. And we're going to work in that way up between the ribs, gliding up along the intercostals, feeling for if I feel any fibrosis or nodule, we might stop, apply compression, a little friction. So what muscle am I on most superficially? If it's true.
is it the intercostals or would it be the?
Intercostals, which one? Which one's the farthest to the outside?
Exterior.
External intercostal.
Exterior.
As we sink in, what's the next layer deep? Internal intercostal. And then the third layer, the deepest layer?
Innermost.
The innermost intercostal. Quick anatomy review. We're reviewing for them too. This is a preview for your guys' quiz, right? Fiber direction for the external intercostal. You can use your hands to point.
Oblique.
Is that an oblique? Which way?
In pockets.
Hands in front pockets. That means the internal has to be the next one,
Grab it.
And then vertical.
and
Vertical.
the innermost is vertical, like my shirt. Okay, I went up until I hit drape. Now I'm coming down a little more, sinking into the next set of ribs. And we're just going to work it all the way around. Feel that little roll right there? That's more superficial though than muscle. That's a little just connective tissue and kind of the hypodermic fascial layer. So a little bit of myofascial stretching will help release that. Okay, so you'll help it. You guys want to feel what it feels like for adhesion and superficial, kind of in the fatty layer of the body? There's one right here. I lost it. Hold on. Right here. Just go back and forth right there. Feel kind of roll and pop.
I have those all over.
Over the ribs, does it feel?
I feel like we're Pentecostal right now.
Person's like, man, everybody's feeling it. with stomach
I know, I'm feeling a little Pentecostal going on.
Get ready. Wow, it's a good shirt for testing. Kill that test.
Is there more that's taking it today?
Just us four.
Do you all take it at 4:30 and then? get it?
4:30, 4:45, 5:30, but we're all gonna go early, see if we can get in.
Yeah.
Like the Backstreet Boys and Young Bucks. Or rather Spice Girls.
Also great.
Posh Spice.
Yes.
Yeah.
Yes.
Ooh, baby spice is always my favorite.
He's an honorary woman.
All right. So on the drape here, it's tucked in the back, but we're going to fold it up on the side. I'm going to fold here, that way it would still cover the breast. If we had any concerns about staying in place, we have the client use their hand to hold it in position. They can really make sure it stays. Then we can work up around this lateral chest as well. There's a whole other adhesion. For that one. A lot of times people ask, how far do I work? How far do I go? You go around as far as you can without pinching the skin against the table. It's going to vary a lot, depend on the individual. So now right here, it's getting thicker. It's harder to feel the rib, but I'm not around deep enough to be the latissimus. I'm on serratus. You feel how it feels different? So this is serratus interior. Serratus attaching to the ribs, 2 down through 9, going around to the medial anterior attachment of the scapula. We won't be able to get that until we're face down. So we can go ahead and continue working up that same way we were, working this entire lateral section of the chest. Quarter 4, we'll talk about scar tissue treatment, plastic surgery, post-op, whether that's breast augmentation or breast reduction scars. A lot of times will be under the breast, in which case this could be a slight fold up to work the under breast scars, or in the axillary. And doing this fold allows us to work axillary scarring. No matter whether people are getting their breasts increased or decreased, scarring is an issue. They want to minimize the scarring because it has problems causing pain and things like that too, but also looks bad. So especially if somebody's doing an augmentation because they want to look good, in their mind they look better, then they don't want to have a bunch of scarring over that. And if people are going through breast reduction, then the scarring can be very, very heavy.
But working under here on the pec major and the lat right here.
Yep, it's all allowable as long as we maintain the proper draping over the breast itself. Can somebody go click my, how do I click the buttons? Or Ashley's got it, cool. Ooh, we do have one more here on the front. So that was intercostals. Next one is serratus, which we did also. The third one is subscapularis.
That's where you want to be?
Yep, thank you. These guys are glad they're here to see this happen. Okay. Well, I can show it on both sides, but I'm going to do it over here since you already have the side drape. It's more convenient for us. Subscapularis is on the front of the scapula. Remember last week, we went into the side of the body and we followed up under the pec major to get to the pec minor. This time we're going to go in, and that was at the front of the hairline. This time we're going to go in at the back of the hairline, except we're going to go in at kind of 45 degrees like I'm trying to press towards the table, and I'm going to pin subscapularis on the front of the scapula against the table. So here you can see latissimus sticking out right there, nice and thick. One of the biggest problems is people try to go into latissimus. Let's just a big piece of muscle. We need to go in deeper to be on the front of the scapula. So all we did last week, pec minor, we went in the front under the pec major, right there. Remember the kinesio for that one was asking a question, because it was involved in upward and downward rotation of the scapula. So when I bring up, the scapula is rotating up. When I come down, it's downward rotating. That's what's engaging it. Now for this one, I've got to go to the back of the body. So now I'm behind the rib cage, pinning the scapula against the table. And the mobility for this one is it medially rotates, so I pin it and then I laterally rotate. Medial, lateral. Medial, lateral. Feel it engaging? You're going to slowly move it. So this is subscapularis. We treat it the same way we did pec minor. We compress, we can do some friction, and then the kinesio forward is just this rotation in and out. All right? All good on the questions? Let's see how to get in from here. Identify latissimus. go in, up and in a 45-degree angle. Pin it, friction it, mobilize it. Alright, I'm gonna bring this hand up so I can move your sheet. Put your pillowcase back. Thank you. Alright, and now we're gonna tent and roll. Don't do that yet. You're draping when you do your tenting. Make sure you pull the sheet up to the edge of the table, pin it really good with your thighs. You don't need to be in the middle of the table, you need to be in the middle of their torso. We don't care if their ankles get exposed, I care about their torso being exposed. Then, don't grab all the way to the edge of the table, grab at the corner of the body, shoulder and hip. Because we don't want to be so stretched out we can't handle it. We want to be just getting the sheet from here, creating a little puck tent. And roll over and scoot up, and I didn't put the headrest up yet.
That'll take points away from you on your,
Yeah, during demo, absolutely.
just so you
That's
know.
not the biggest thing people lose points for though, it's the bolster. There's no bolster in, but make sure you take your bolster out before they roll, put it back in afterwards if they like a bolster. Don't have them roll with the bolster in, that'll cost you points too.
Don't touch your face. And don't freak out and cuss.
Brian.
And don't wear long sleeves, even if they are pulled up, because if you accidentally touch, you'll get points taken for that.
Ashley?
Yeah.
Top of the slides?
Top of the slides?
Yeah, we did, yeah, we need to go to the supine. Just back it up about 15.
Okay. Hey, excuse me, exit.
Yep, that was intercostals. Alright. So we're starting with intercostals, but we already did intercostals. Well, remember the rib cage goes all the way around. So the same technique, we just gotta do it on both sides. The angle seems different because now this is all nice thick muscle here along the sides. Focus on the side body. The ribs go down, kind of downwards on the back, and they go back up on the front. So on the front, I was facing towards the shoulder working. Now on the back, I'm going to be kind of working towards the hip because my fingers sink into between the ribs at a very different angle.
I was gonna ask you, using all your fingers.
Yep, one in each gap. Because I've got a lot of gaps here. Just maximize my work. Work my way down. I glide a little bit. I'm feeling fibrosis, and there's a lot of it. So you'll notice I'm frictioning almost every time because one of my fingers is finding a fibrotic spot. Now in this case, the lats here are nice and relaxed. I'm just working right through the latissimus. If I had somebody who had a really thick, developed lat, then I might not be able to even palpate very well until I got to the side of the lat. But each individual, some people get more work or less work depending on their body size, shape, muscle density, fat content. We're all different bodies. We all need different care, and we all get different care. Come back, find another line, and repeat. Working down here on the scapula. I'm just going to come to the edge of the scapula, see if I can sink in and do a little bit right there. There's not very much because there's a lot of thick muscles, so I can't feel it very well. Okay, so mostly just this section right down here for the intercostals. Rhomboids major and minor. All right. Rhomboids get a lot of warm-up just during your normal Swedish warm-up. Rhomboids are chronically overstretched. We can see how the scapulas are already well off the center. They're already abducted from the center. We're just warming them up. Basic Swedish, Palmer glides, soft fist, deep ulnar. Motion for that. All these are just warm-ups just to get blood into those overstretched, traumatized muscles. The rhomboids are not in pain because they're overworked. They're in pain because they're overstretched. Everybody wants you to work on rhomboids because that's where their pain is. That's not where the pain's coming from. They're the victim. in order to, really treat the problem, we need to work this area, because just working on it's going to make it feel better, it's going to make the pain go away temporarily. But therapists that only ever work this, because this is where it hurts, within 2 to 3 days, everybody's pain comes back. A lot of you have probably been to therapists multiple times where, oh yeah, it feels great, but then in a couple days, it hurts again. It's because they're working on where the pain's at, not what's causing the pain. So we're definitely going to work this area, but then really focus on the front, work on the pecs, moving the shoulders back into position. Preferably followed by that stretching we did earlier, the torso twisting stretching. So we're going to be working spinous processes, working on our lamina groove with whatever tool you prefer. Not going to go back through them all again, but if you're noticing, pretty much every week, lamina groove. Because on the back, every major group has major attachments to the spinous processes, transverse processes, or just lays in lamina groove between the transverse and the spinous and transverse processes. So in this case, we are attaching spinous processes C2 to T4, 1 or 2 above or below, depends on the individual, but C2 to T4 is going to be our general region, slightly into the neck, about 1/3 of the way down the ribs. The muscles lay like a Christmas tree pattern, kind of attaching along the border of the scapula, the medial border of the scapula. There is the major, the lower section, the minor, the upper section, but we can't differentiate them. We can't feel the difference between them, and they do the exact same action. So as far as we're concerned, the idea that there's a major and minor is pretty much intellectual. That's why they're on the same slide. We didn't differentiate them because we treat them the same and they act the same.
Excuse me. I
All
gotta
right,
sit
on the
down. I'm having a
scapula.
hot flash
I'm
or
gonna-
something.
I'm gonna work this side. You want to come around this side?
Whew. I was freezing in here earlier.
All right, some of you are already fans of doing this jobby with the elbow. It works, it pops the scapula out a little bit so you can get around it. I have never been a huge fan of it because I don't know that client's shoulder mobility, or if they have, I should know, hopefully they told me if they have previous shoulder injuries. But even people who haven't had known shoulder injuries, a lot of times just have so much shoulder tension, this is not a comfortable position. So a lot of people do it, a lot of therapists do it, that's fine, it's never my preference. My preference is to bring my hand up under the front of the shoulder. Get real fast. I just bring it up, my fingers are touching the head of the humerus, and when I push on it, it pushes their shoulder back. So watch when I do that, I come up under, my fingers are right under the head. When I do that, push the shoulder up. So what I can do is I can put my fingertips right here at the bottom of the scapula. Now, I didn't push my hand under the scapula. My hand is just here against the ribs, and I push the scapula over my hand. See, my hand on the back is not moving. This is me moving the shoulder. See? Now I can work really well here. And whereas if I have this hand pinned behind the back, that's the position, it's stuck. When I do it this way, I can control the position. I can mobilize it and move the scapula while I'm underneath it. I can work all along, getting all these attachments along the edge of that scapula. All I have to do is I've just got my fingers stacked. Gliding up along the attachment.
That's for the serratus anterior, right?
So I'm working first the rhomboid attachment at the edge. When I go up underneath,
That's the serratus.
I'm getting serratus.
Okay.
Right there. Because now my fingers are focused on the front of the bone. I'm coming from the anterior side. Now some of you, your scapulas won't be this mobile. They won't be able to get underneath this deep. This is pretty mobile scapula. If I want to get even deeper and use both hands, I'll use the sheet and use my knee to support the scapula. Rest it, rest it. He's kind of panned it back for me. You're holding your shoulder up. I got it. I'll support it. Can't let go. Let's see.
I'm trying.
I know. Do you feel that you're holding it up though?
Yeah, I feel it, but it's like I can't do it. I don't know.
Because right here, he's letting me move it around really well.
Yeah.
keeping it free and keeping it empty. Okay, keep it loose, keep it loose. Here we go. Feel that? Feel how you're loose? All right, all right.
Breathe and say this.
All right. Nope. All right, there we go, a little bit.
It'll move, yeah.
Okay. There we go. All right. Now we can get underneath. We can really lift that scapula up.
Oh.
Oh, it feels amazing.
We can get up under there. And my fingers are up inside. So I'm working the front of the scapula, getting those serratus attachments right at the tip. If I go under deeper, I'm getting subscapularis attachments. And I can really strip the edge. Whew, good job.
Unless you cut the skin, you're not going to pull the scapula off of all.
Yeah. Which we're not
It's
doing.
not gonna come
We're not
off.
cutting
You
things.
can pull.
You all right? Uh-huh. Okay, now I can make vertical lines, plowing, like we did on the pec last week. We were making plow lines across the pec, feeling for any adhesions, anything to work out. Same thing on the whole rhomboid section, except now we're plowing up and down. Why don't we plow across?
Don't want to link.
Because it'll lengthen it.
We don't want to lengthen the rhomboids. We want to work it without lengthening because they're already over lengthened. And these rhomboids actually feel like they're in pretty great shape.
You
There's
have
the-
her work
there's the whistle.
inward toward the vertebrae?
That's still lengthening. Because anytime if I'm going this way,
Yeah.
the fibers are getting longer.
Right.
If I'm going this way, fibers are getting longer.
Yeah.
I can go up or down. I prefer to always go down because it's convenient for me to stand up here.
Easier.
But always up or down, not across. Cool? Right on. Serratus anterior, we already worked that because we came right up underneath. Deltoid, perfect. Deltoid can be worked face up. I prefer to work it in the face down position. I'm going to bring the arm off the table. Notice when I did that, here the humerus rotated back. When I bring the arm off the table, it rotates it, so now I can get access to the front of the deltoid too. I can actually work all three sides in this position. So back here in the back, actually pinching right there, that's posterior deltoid. Here's the middle delt. I can reach underneath and grab the anterior delt as well. 3 different heads. The upper attachments, we worked the trapezius attachments a few weeks ago. We were above the spine of the scapula, and we did that plus, plus, minus, minus work. It's the exact same work right here for deltoid because it attaches to the same place, all the way around. On the deltoid tuberosity, I told you guys how to find it on yourself. Feel the side, glide down till you find bone. Right here on this one, I can actually just see exactly where it's at. If you can kind of look down the arm, you can see where the deltoid ends. See how a nice curve and just boop, flattens out? That's the point. But you can't see it on people, you can't see it on everybody. You just feel the muscle, glide down till you feel bone, and then you're in the spot. We compress. This is the deltoid tuberosity. We friction superiorly, going from bone to muscle, bone to muscle, bone to muscle. Warming up the delt. Foaling is a really good form of petrissage for a big round muscle. My fingertips under the front of the shoulder. Press down with my palm, smashing the muscle. Press, lift back up. Press, lift back up. Press, lift back up. It's just a general warm-up. My main form of intensive belly work here is versions of stripping. So I'm going to curl my fingertips to make them straight. You could also use Russian or something if you're having a hard time with your fingertips. And I'm going to go, always start with the deltoid tuberosity. I'm going to make 3 lines going to 3 separate attachment points on the shoulder. The first one is going to go from deltoid tuberosity around to the spine of the scapula. Deltoid tuberosity straight up to the acromion. On this last one, the first one just came around, the second one straight up. The third one, I'm following the curve of the body, so my hand has to rotate to meet the clavicle,
To get the anterior.
to get the anterior. Looks like
So it's
this.
kind of like when you're working the temporalis.
Uh-huh.
Kind of just going in 3 different
Yeah, except all those were flat. They were just 3 different directions. This one I got to follow to the back of the body, straight up the side, and around to the front.
Okay.
So here's the round to the front. I'm stripping, follow the delt. See the whole shoulders kind of being lifted, clavicle. Is that all right? Okay. Now we're going to combine techniques. We did deep stripping for lengthening. Now we're going to use vibration, which is very relaxing to the muscle. It also makes it more intense. Remember kinesiotherapy, the vibration can make it more intense. And so, some of you have seen like old kung fu movies, like Bloodsport.
That's a good
One
one.
of the best ever. Can't remember his name.
Van Damme.
Jean-Claude Van Damme.
Van Damme.
So a lot of the old kung fu movies / Jean-Claude. As soon as he does something awesome, like drops into full splits and punches somebody in the groinal area, always does this kind of pause. They tighten up all their muscles and they go, and their whole body just shakes. Their body shakes because when you tighten opposing muscles, they kind of fight against each other, creating vibration. And that's what we're going to do. We're going to tighten the bicep and tricep together, create a natural vibration in our tool. Now repeat the same 3 lines, but now with vibration. You can see the whole shoulder vibrating. You feel a difference? You feel more intense?
Yeah, definitely.
And all I was doing was just shaking. Now some of you all, you have to practice this at home. You just practice in front of the mirror at home at night. Brush your teeth, and at the end you straighten your arms and you go. Practice with your kids, especially if they're into watching anime type stuff. Tell them if they keep practicing, they'll be able to develop a chi ball they can shoot at their teachers.
Or if they're misbehaving, just be like,
Okay. Some of you are going to struggle with this. Some of you, in every class, some people struggle with the coat contraction. If that's the case, you just try to vibrate really fast, okay? Until you
Fake it till you
figure
make
out.
it.
That's right.
Yeah,
All right.
I'm just trying to vibrate you.
So, as far as actions go, from delta tuberosity
Maybe
to
think
spinal
something
scapula
else.
would pull back, cause an extension or lateral rotation. Anterior would pull forward flexion or medial rotation, and the out midline, middle or lateral delt would pull up, causing abduction. Those are actions. Ashley,
yep, sorry. I'm shaking her shoulders.
great job. Supraspinatus. So we were up here doing the plus minus right kind of on top of the spine of the scapula to release the trapezius and then the deltoid attachments. Now, if you feel somebody's supraspinous fossa, it is thumb-sized. That's convenient because my thumb fits right inside of it. So right above the spine of the scapula, there it is, the spine, going right up and above it. My thumbs, I'm using my W thumbs, fit right in that groove. I can press in and then I can glide towards the acromion. This one's pretty smooth. There was a little, you feel that little guy right there? There's a little something right there, but this is pretty smooth. Some people are chunky. This thing is full of fibrosis. It can be rock hard. And we're just going to keep going through that, doing plus, plus, minus, minus through that groove, just kind of forcing that muscle to let go and stripping any fibrosis out. So I'm just going up, up, over, up, just right through that groove. Like I'm trying to scrape the bottom of
To
the
the
ice
acromion
cream
process.
to the acromion process.
Okay.
Multiple lines, as many as you need to. It's the same groove, but just multiple repetitions until we get all that little chunkiness out. And then eventually I should be able to come back and glide through. And there was no fibrous pop that time. You feel that was gone? I'm gonna just smooth it out. No chunking peanut butter, smooth peanut butter. So that guy goes from supraspinous fossa deep to the acromion to the little knob on the outside of the humerus. Big bump, major
Greater-
attachment point on the humerus. Greater
Greater tubercle.
tubercle, causing abduction. It initiates abduction. What's the name for any muscle that's small next to the joint and initiates the action?
Intrinsic.
Intrinsic.
Intrusive.
All right, infraspinatus. Infraspinatus, I'm putting the arm up on the table to create a little more stability. I don't want to push really deep on that arm off the table, and I've never heard of it actually happening, but I always have this fear that I'm going to accidentally dislocate a shoulder. Now it's on the table, it's more solid, more secure. Making sure there's some good lotion on this inferior scapula. Just going to warm it up. A little bit of soft fist. Now I'm going to use soft fist, and this is one of the rare times I violate my own. Soft fist should always be like the position you're holding the gun. I'm going to go fingers first because I want to focus the pressure on the fist knuckles. Here's a scapula. Scapula is a triangle between the spine of the scapula and the edge. See my triangle? I want to work that triangle off to the shoulder. My soft fist covers that area really nicely.
Is this the infraspinatus?
This is infraspinatus. And a little bit of teres minor too. So I'm getting my soft fist over there. I'm getting over it and keeping my joints stacked so I'm not wobbling back and forth. And let my body weight strip down off the shoulder.